Okay, Mr. Chairman, I believe we're ready to start.
All right. Thank you, Jerry. We'll go ahead and call this meeting of the Eastern Idaho Public Health Board to order. It is Thursday, April 1st at 7 a.m. We are streaming this meeting live on Eastern Idaho Public Health's YouTube channel. And there's also a room available at the meeting location for any public who wishes to join. We'll go ahead and begin with a roll call of our board members. And we'll begin with Teton County.
Bill Lake, present.
And Fremont County.
Blair Dance, present.
Madison County.
Brett Mendenhall, present.
Jefferson County. I didn't see Commissioner Young. Do we have Clark County?
Greg Shanton, present.
Okay. And I believe we have not been joined yet by Lemhi County. Custer County.
Wayne Butts, present.
Okay. And I'm Brian Reed from Bonneville County. We are also missing our physician, Dr. Nelson, today.
I'm here.
Oh, Dr. Nelson, I didn't see you. Thank you for joining us. We also have with us our, of course, our director, Jerry Rakow, as well as our epidemiologist, James Corbett. Also in our meeting today, we will hear from our division director of clinical services, Amy Gamet, our chief financial officer, Stephen Thomas, and we also have other division directors with us today. We're also joined by Mr. David Hoffenberg from the Eastern Idaho Regional Medical Center, who will give us a report a little later in our agenda. As other board members join, Jerry, if you notice them, please let me know.
So we do have Commissioner Young now with us.
Okay, welcome, Commissioner Young. We'll go ahead and move to our consent agenda. There's 3 items that require action today. This can be done in one motion if you desire. We have approval of our March 4th meeting minutes. We also have the fiscal year 21 year-to-date financial report, which was included in your packet and is on our website for view. And it looks like there was another change in the subgrant. So we have a ratification of the subgrant. Are there any questions or concerns with any of those items? Jerry, did you have anything that you wanted to add or make special note to the board?
No, I don't.
It looked like the 2021 year-to-date financial report was as expected with the amendments that we had made. Looked like we were in good shape, slightly under on expenses and slightly over on revenue, but as typically budgeted. Hearing no discussion, I'll welcome a motion when the board is ready.
Mr. Chairman, this is Commissioner Mendenhall. I would make a motion we approve A, B, and C under consent agenda.
This is Commissioner Shanton. I'll second that motion.
Okay, we have a motion and a second to approve all 3 items in our consent agenda. All in favor, say aye.
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 Is there anyone opposed? Okay, thank you. We'll go ahead and we're going to change the order of our agenda slightly out of respect for Mr. Hoffenberg's time. We will go ahead and move to item 5, which is our COVID-19 situational report. And we'll just go straight to David Hoffenberg from the Eastern Idaho Regional Medical Center. I understand you're going to give a bit of a report for the entire area. Is that right?
Yes. Can you hear me?
Yes. Good morning.
All right. Good morning, everybody. This is David Hoffenberg. I'm the Chief Operating Officer at Eastern Idaho Regional Medical Center. And yes, I'm going to be representing both Casey Jackman from Idaho Falls Community and Rachel Gonzalez from Madison Memorial to give you a report on all of our facilities right now. As you all probably know, we've seen a considerable uptick in our patient population as it relates to COVID over the last month or two. Since our time in February where we had dipped into the single digits, we have more than tripled our COVID inpatient volumes. And we've been treating between 25 and 30 COVID positive patients at ERMAC every week for over the last month and a half, which obviously has put a tremendous strain on our facility, being the regional trauma center, cardiac center, burn center. We want to remain open for those services, but having this additional volume on top of that has added a considerable burden to our facility. And our main concern is to remain open and to keep our doors available for patients who need time-sensitive emergent care. And that's been a challenge. So as of today, right now, ERMAC has 25 COVID patients in the hospital, 13 of which are in our ICU. And just so as a reminder, our ICU size is 29 beds. So 1/3 of our inpatients in the ICU are COVID positive. Again, filling beds that are needed for other emergent needs such as traumas, strokes, burns, and the like. And so that has added a considerable additional load to our team that we were not typically seeing. But obviously other factors are playing into that. We are still treating the whole region's population. So we are seeing patients with COVID from as far as Bear Lake and Caribou County, Teton County, Wyoming, Teton County, Idaho, and all over the region. So again, trying to keep our services afloat so we can continue to treat the region's emergent needs. But right now that's been a challenge here at ERMAC. At Madison Memorial, per Rachel, over the last few weeks, before March 11th, that was the last day that Madison Memorial had no COVID patients in their hospital. And since then, they've averaged between 2 and 3 patients until just this last week, where they were seeing an average between 5 and 8 patients, primarily med-surg, but usually at least 1 in their ICU. As of yesterday, they had 4 med-surg patients and 1 in their ICU. So that's where Rachel is right now. In terms of Idaho Falls Community Hospital, Casey, their numbers sit at 18 COVID patients with 5 in their ICU, and 3 of those are on ventilators. And just like us, we actually, I believe all of ours are vented right now. And between the patients that Casey had reported on, this was more of the alarming information that 5 of the patients he has have had at least 1 round of their vaccinations, and even 2 that have had both of their vaccinations with at least 14 days prior to diagnosis of COVID. So we are seeing that, as even though the vaccination is effective, it's not 100% effective. So patients are still able to contract the disease. So as we all know, as we educate the public, remaining vigilant and not seeing vaccination as a free pass to go back to completely normal until we have herd immunity and we have the vaccinations rolled out across the whole population. There's still risk. There's still the need to socially distance, to still mask, and any more education and push we can have as a group in our region to get that word out. It is very important at this time because we see spring break just happened, and we anticipate we're right at the cusp of seeing those patients start to show up become positive in terms of showing symptoms and then start coming into the hospital. So we are already at capacity, it sounds, at least in this community, in terms of our overall bed availability, and staffing is a challenge across the board. So it's not the situation any of us would like to be in. It's not at all where we hope to be at this stage. Looking 2 months ago, I think, thought that we were really seeing things in a better light, but we've taken a turn, and the hospitals are seeing that impact. So that's what's going on from the hospital perspective right now.
Mr. Chairman, may I ask
Yes,
David a question?
Yes.
So David, as I see the daily reports from hospitals across the state, it looks like it's not a widespread issue as far as hospital capacity. I know it has been for our region, but can you speak to just statewide capacity and what that's looking like?
Oh, I would have to really, again, speak to our local area. Outside of the hospitals I've talked about, I do know the situation down at Portneuf. I spoke to Nate Carter, their COO, earlier this week, and they were not as hard hit as we were. When I last spoke to him, they had 12 patients in their ICU, and that was as of, let me double check, that was as of Monday. 12 patients in their ICU, and they're about a 20-bed ICU, so they still had capacity. So yeah, I think that if you center it around the region, our district is seeing it worse, for sure.
Thank you.
Are there other questions for Mr. Hoffenberg? David, can you help me understand when our region is seeing such a surge, and your hospital is one of the hospitals I noticed in the state that is reporting some stresses, why are you then receiving patients from outside of our health district when Portneuf is not near capacity, when other hospitals have so much more room? I don't understand the dynamics of how that works for Eastern Idaho Regional Medical Center.
Well, we do our best to, again, remain the regional trauma center and bring in that support. But when there are patients we cannot accept, we do lean on other facilities. And that's our typical practice. So to say we're taking everybody right now isn't true. There are patients we have not been able to accommodate. And for every patient that leaves our ICU, we've been refilling them with someone else, and that could be someone local or someone from throughout the region. Our perspective is we need to keep our doors open for the patients we can treat, and to just shut down completely for a period is just not something as a trauma center you really can do. We at least will help treat, stabilize those patients needing critical emergent intervention. And then if we do not have a bed, then we would work with a facility like Portneuf to move those patients for their ongoing care. So that's just how trauma centers really have to operate. We may be the only place for a heart attack to come in the time span that they need that treatment. So we have to be able to provide that life-saving intervention. But again, the ongoing inpatient care, we absolutely do partner with other facilities to do that. And we've been doing that actively over the last few weeks. So to say we are open for business and we're taking all comers is not true at this moment. We are seeing those strains, and we're having to manage through that capacity on a daily, hourly basis in our ER. And the other challenges too, as much as we would like to be able to handle all the patients from the region, we still have to treat our immediate community. And as an ER, you never can truly close your doors to the folks walking in. And so folks who come to the ER and end up needing ICU level care, they're they're here and we have to treat them. But even at that point, if we didn't have the bed or ability to admit them, we would then lean on a Portneuf or University of Utah Intermountain Healthcare to help offload some of those patients. But we will always treat the patients we have the ability to treat. We will never turn away someone if we don't have the capability and capacity to do so.
Right. Well, we certainly appreciate everything that you're doing. Are there other questions?
Mr. Chairman, I do have one more. I'm wondering, David, can you talk to us about the demographics of the COVID patients that you're seeing?
In terms of age and
Yes.
location. So, it's interesting. It's across the board. Over the last couple months, it's been consistent that it's not a single age group that we're treating. I mean, obviously we do have, especially in some of the more critical patients, folks with, other comorbidities or immunosuppressant related diseases where they are susceptible to COVID, older patients, but we are seeing young patients. We are seeing folks in their 20s, in their 30s, their 40s. And so as we've known for a long time, this is not a age-specific disease. This is very, it'll affect patients from across the board. So I don't have that data in front of me at the moment to give you specifics, but I can say that the age demographics are widespread.
Thank you.
Okay, seeing no other questions, thank you for that report, for being here with us today. Jerry, we'll go ahead and move on with your information.
Okay, I'm going to turn it to James to review the data with us. Just a moment to pull that up.
As Jerry's pulling that up, as you know, at our last board meeting, the beginning of March, we're starting to see an increase in cases, in many of our counties, but particularly in Bonneville County, that is extended through, both Bonneville and the Highway 20 corridor through Jefferson and Madison County. This again is just our landing page. You can see the current rates in yesterday's cases, depending on what time you access this at. Yesterday, we did see an increase to 147 cases. We did see a dip down the end of last week and the beginning of this week, Monday primarily. I'd attribute that similar to other holiday weekends that we have not as many people in town, potentially, others taking advantage of spring break and not as many individuals getting tested. However, we're seeing a rebound from that as individuals come back. I know the testing centers in many of our counties were busier than normal or busier than they had been the last week or so on Monday and Tuesday testing individuals. And our numbers reflect that on then Tuesday, Wednesday, and most likely today, as individuals come back from spring break activities potentially, or even activities that they stayed and did. Can we go to page 3, Jerry? I want to look at the district level cases here, and I'd be happy to have questions regarding any counties, but you can see in October, November, and December is where these are incident cases along the bottom. You can see that we had many, our bulk of cases in that time frame, and then experiencing some slowness in January and February, which I believe David Hoffenberg illustrated with the reduced numbers in the hospitals as well. We've now seen a slight increase. We were seeing a decrease, however, from that kind of peak around the 10th or 13th of March, I believe. And then just here on the far right, you can see that we are increasing the last 2 days. Now, I'm hopeful that that doesn't continue, that people will heed our advice on not maybe transmitting that to others around them, and that we can get over what I am going to attribute the last 2 days to is that spring break reduction or increase, some of the spring break activities. And I'll just take a moment to talk about some of the activities that we feel might have played a part in that March timeframe. Certainly, individuals and I think some of the media were potentially attributing it to the mask mandates being lifted. I'll say that could be one reason, but the bigger reason is still that individuals who are ill or sick move around others. I can't stress that enough through our contact tracing, our disease investigations, that many individuals are not heeding the advice, first and foremost, to stay home when they're sick. So this can include smaller gatherings, such as your own household. Of course, we see that transmission occurring a lot. Workplace transmission, we see quite often, small friend gatherings. But we also see it in larger gatherings. And I think this is, as the governor also increased from small groups in February, I believe that date was, early February, to larger activities that can happen. Individuals don't want to miss out on those activities. And they'll continue to go even when feeling ill. I don't want to give any particular cases for just to show, but some of these activities can include like district basketball tournaments that were happening at the end of February and early March, or state tournaments for basketball and other sports. Full, gyms and individuals don't want to miss out on that opportunity. And we certainly understand why, but as David Hoffenberg illustrated, it's not the time to necessarily to let down our guard. It's still active in our community, even though we were seeing lower number of cases here in January and February. Those are still quite high, and it was not time to necessarily let down our guard. We have seen some breakthrough cases in vaccine. I can give you some specifics on that though. 199 individuals actually have had a case or a SARS-CoV-2 reported to Eastern Idaho Public Health and had at least one dose of the vaccine. Of those 199, 13 are actually vaccine breakthroughs, what we term vaccine breakthroughs. This is individuals that have had both completed their series, whether that's a 1 dose or a 2 dose, and had 14 days post-vaccination of the second dose or the first dose in the case of Johnson & Johnson, and then still come down with illness. Now, 13 is not a very large number. That's from January forward, when people had the opportunity to get both vaccines at times. Contrast that with the overall cases since that time are almost 7,000. You can see that while the vaccine is not perfect, it is still very good and a good way to help us achieve our outcomes. It's not the only way, but it's a very good way. And we want to continue to emphasize that's a viable aspect. Speaking of the hospitalized with vaccine breakthroughs, individuals have to understand that the first dose does not, it does need to be 2 doses of the vaccine to be completely and fully immunized. We want to continue to stress that to stay vigilant even after your first dose of the vaccine. I think David used some good language there. It's not a license for anything at this moment, but we do expect that it can help us to return to more normal as we get more vaccines and we achieve that herd immunity. The vaccines also, so of the, there has been 2 hospitalizations in the vaccine breakthrough. I can tell you that those weren't completely unexpected. Individuals need to know if they're immunocompromised or other that may make the vaccine less effective or severe health concerns, that it's still a concern to them that and COVID is still a real and potential hospital trip for them. And they need to stay vigilant around other individuals that may not have been vaccinated. I'll just mention with the hospitalizations in general, we are seeing an increase that we attribute to those higher cases. We do know that they come, a few weeks after. We're hopeful that the hospitals will see some relief soon with this downward trend that you can see on the right side of this graph here towards the end of March, that we were seeing some lower cases. And we hope that the spring break bump the last few days subsides quickly, and that we can continue on our downward trajectory so that our hospitals can feel that burden lifted. With that, I will stand for any questions that any of you might have.
Are there any questions? Go ahead, Commissioner Mendenhall.
Thank you, Mr. Chairman. James, as I was listening to the report regarding folks that have contracted COVID after the vaccine, where this is a public meeting, I just wanted to make a statement that is not a reason to have the folks who on social media and other places are saying, well, what value is the vaccine? What were the numbers again? How many, do we have any idea of how many? I know Mr. Hoffenberg reported they might have had one, and it just strikes me that we allow things to overshadow our better sense that we should still seek the vaccine. We should still get it. I have received it. I'm done. And I don't have any hesitations about that, but I worry that some of the folks will spread the urban myths that, oh, the vaccine is of no value. And I just wanted to make a statement that I personally am not trained in that, but you are. Help me, that is not a correct statement, right?
You're correct. That is not a correct statement. So I give you those numbers not to say that it doesn't work, but the exact opposite. The vaccine is working, and it has been very helpful. So again, your chance, if you're in the general public in the last 90 days, let's call it, of having COVID, our total population was 2.9% had a COVID positive test or SARS-CoV-2 test, right? 2.9%. That same opportunity, if you were fully vaccinated, was 0.074%. So that's a drastically different number. Again, 13 actual breakthroughs in the last 90 days versus 6,857 total cases. So you can see that the vaccine is effective. It is helpful. If you're fully immunized, please help others around you get fully immunized, I think is the message, so that individuals can create herd immunity amongst their smaller gatherings as well as our community in general.
Thank you, Mr. Chairman. And I just wanted the public to hear that they didn't get any false thoughts or ideas. And I was very confident that James would back me up, because there are folks that just common sense is just not present in a lot of things. Thank you, James.
No, thank you for the opportunity to clarify.
I have a question.
Yes, go ahead, Dr. Nelson.
Where are we in our region testing for the variants and reporting those?
Yeah, great question. So as announced last week, we did have two different variants identified in our health district, both a UK variant and then a California variant as well. We've tested a number of individuals and continue to increase that testing sampling. And I say we, I should not say we. The Idaho Bureau of Labs actually conducts the sequencing for those testing of the variants. Providers can send that in, or public health can send those in if it's a concern. We've sent in a number of those. Many of those have come back as either a normal variant quote unquote, are the normal strain, or they're pending. Many of them are still pending because it does take some time to do that sequencing. Very few have come back with positive results. The state has actually on their dashboard under the laboratory testing, if you go to coronavirus.idaho.gov, and I don't know if we'll bring that up, Dr. Nelson, the laboratory testing section under coronavirus.idaho.gov on their dashboard will get you to the variants and the variants that have been identified. Now, I do know the state is working on hoping to delineate those by health district, but they have not yet been able to accomplish that. We're going to start sharing this here. So again, at coronavirus.idaho.gov, under that dashboard and under laboratory testing, you can see that the total viruses sequenced have been 433. 26 have been found to be the UK variant, 2 of the South Africa, 15 of the California variant. So total variants of concern are 43. So again, we were notified from the Idaho Bureau of Labs that there was a UK variant found, as well as the B1429 California variant found in Eastern Idaho. Again, we've sent in approximately 120 variants of that 433. The last time I had heard from the Idaho Bureau of Labs, from providers and other individuals to look at sequencing.
Are there other questions?
Yes, Mr. Chairman, this is Commissioner Young.
Go ahead.
I had a question for James. James, even though we've had some breakthroughs on the vaccines, I know that, with the flu vaccine, that if you get the flu vaccine, it's not as severe. Is there any data showing that if a person does have the COVID-19 vaccine, that the severity maybe is less?
Well, I would point to, but I would even go back to, it's doing a very good job of even preventing the symptoms of it for people to seek testing. 0.074% is a very, very small number, as you can imagine. So we're confident, as well as the CDC came out, and their confidence level is increasing in these vaccines as we get them into individuals. So the severity also lessens, but I think it also is helping to even prevent the disease from happening. I mean, even more so.
And I would just share that on Tuesday, the Department of Health and Welfare at their media briefing did share that statewide there were 97 breakthrough cases, and of those, nearly more than half were asymptomatic individuals that had sought testing for reasons other than having symptoms, whether it was for their workplace or they'd had a close contact with someone.
Or traveling,
Or traveling. And then about, I think she said 47% had mild symptoms.
80%. Actually, I have the data in my presentation.
So Amy's going to talk more about this in her presentation, but yes, just what James said.
Okay, that sounds encouraging. Thanks.
So James, I had a question that I'm not sure you can answer, or if there's an answer for. It's been so troubling to see, the high spike in our area, and particularly Bonneville County. Neighboring counties, some spike, but particularly it was really centered in Bonneville County, which is the largest population. And so maybe that's the reason. But while we were seeing that, we did not see it anywhere else across the state. And activities were going on in other areas. There was, no mask mandate in Twin Falls. The Central Health District had lifted it in Ada. And like I say, the activities, the tournaments, everything was going on across the state, yet the spike was centered here. Do we know why that that would have happened. You reported that only 2 variants were found. Do we have any idea why that spike occurred kind of centralized right here?
Yeah, and I appreciate you giving me an out of that there may not be answers, because I don't think we truly know. But there are variants found in other locations too, so I can't necessarily lay this just at the feet of the variants. I don't believe that's just entirely true. I don't believe that it's there were activities, other things. What I think would be a great way to address this, though, is the power of one, right? This is where a great example of how much power one individual can kind of hold, in that it starts with one. If one individual goes to work ill, or starts that spreading type cascade event, it really can affect multiple people, right? And we showed this graph at a previous board meeting, and I apologize, I don't have it in front of me, but you know, as it exponentially grows. One can pass it on to 3 others. Those 3 others quickly pass it on to maybe 3 others, and now it starts exponentially growing. You know, so you have 1 to 3, and then 3 to 9, and 9 to 27. So you can really start picking up steam really quickly if we're not all vigilant about it. So I would just say that while I don't have an exact answer for you, Commissioner Reed, I would say that I think it shows how one individual can help and hurt this cause. So please, I would just, everyone is helpful in this fight against the disease.
Okay, thank you. Are there other questions for either Jerry or James? Okay, we'll go ahead and move on then to our vaccination rollout updates.
What we wanted to start with first is just to show you the state of Idaho's vaccine page dashboard. And I'm going to leave it to James and Amy to walk through this, and then we'll turn it over to Amy for her presentation.
Want me to start?
Yeah.
So this, they continue to add additional data in the vaccine land. This is the initial landing page. So kind of an overall picture. The doses administered in Idaho now are a little higher than the national average. So the amount of vaccine we received, almost 80% of that has been administered. And then actually, Jerry, I'm gonna have you move over to I can't see the top on here, to the vaccine uptake. And I'll just point out a couple things and then would encourage everybody to look at this. So down at the bottom, there's the vaccination rate per county view. And so it gives the percent for each of our counties, and you can look at it in the map or the bar graph down at the bottom.
And if I can just point out something on this page, the buttons here at the top left can be very impactful. So the vaccination, you can click on just the fully vaccinated individuals, and you can see that change. So if you go up just a little bit, Jerry, you can actually choose by county or public health district as well, and not just the vaccination rate, but maybe individuals vaccinated if you'd like to see that. So again, both percentages and numbers if you'd like to there.
Thanks, James. And then down at the bottom, though, you can see each of our counties. And actually, Jerry, if you'll click back on the fully vaccinated.
Both or just?
Both, yeah, they're right there. So then you can see both of those accumulated together and look at our 8-county region across the bottom there. And even if you hover over those, again, it'll give you that picture view of fully vaccinated. And then if you move up to the second percentage, those receiving 2 doses. And so that's the culmination of both of those across the bottom on there. And then if you'll move back up to the top. Demographics. So same thing there, you can see the age group. I'm not surprised to see the 65 and up age group, the highest uptake. I mean, that was the early group that we opened February 1st. We're now also reporting race and ethnicity. So I think you'll start to see more of that reported instead of in the unreported section. And then even looking at rural versus urban and frontier communities. And then back up to the top vaccine providers. Here you can look at districts, what has been administered in our districts. You'll see that for Eastern Idaho, 84,000 doses have been distributed. If you click on Eastern Idaho there, Jerry, you can see 70% of those have been administered. And then if you scroll down, you can see the providers in the area, the amount of vaccine and then the amount of vaccine that's been reported administered. I was looking at our data for even Eastern Idaho Public Health. We, at this point now, have almost administered as much vaccine as what was in some of the clinical trials. So that's just amazing data to me as well. And so again, I would encourage everybody to go through and look at this. If you have any questions, reach out to James and I. They continue to keep adding additional data in here as well. And then if you want to go ahead and go to the presentation, unless you wanted to talk about the pre-registration.
Yeah, just very briefly, as we were meeting last month, we reported that the state was implementing a pre-registration tool that's been in place now for a month, and it allows individuals to go to the main website and put in their information and get on this registration. And then providers are able to go in and pull down batches of people that have registered on that tool to contact them to get an appointment for them. So you can see, across the state, these are people that have registered for the tool that are unclaimed at this point. Some of that is because, like in the 16 to 44-year-old group, I mean, that isn't fully open yet. Basically today, I would announce that many other health districts throughout the state have already opened that group. And officially today, we're expanding into the 16 and older group. So any individual that's 16 or older in our health district region is eligible to get an appointment for the vaccination. Are there any questions on this dashboard before we go on? Okay.
I just wanted to give an update on a couple of different things. Currently, with the Janssen vaccine, the Johnson & Johnson vaccine now out for a couple of weeks, we have 3 authorized vaccines in the U.S. As of the end of February, there's still 2 more vaccines that are in phase 3 clinical trials. Nationally, lots of doses have been administered, over 150 million. And this was March 31st, so as of yesterday. And not surprisingly, Pfizer has had the most doses administered, followed short, by Moderna, and then Janssen just being out recently. Again, a lot of doses administered in the U.S. We kind of already talked about this. I guess one thing I didn't point out, though, the overall number for the state of Idaho as of yesterday that have received vaccine in Idaho is 447,193. And then again, please do go look at that landing page. So one of the main things I wanted to talk about was just the safety of the vaccine and then the data that's been coming in for that. At the beginning, I had talked about Be Safe. So Be Safe is everybody that receives vaccine is given this information where they're able to sign up through Be Safe and then report any adverse events. So basically they get a check-in daily for a week and then weekly for 6 weeks, and then kind of a survey at 3 months, 6 months, and 12 months out. It's completely voluntary, but every recipient does receive a sheet on how to sign up for it. So some of that data starting to come in. This is the report through February 16th. So almost 4 million individuals have reported to be safe. And then something that's been important is anybody that was pregnant at the time of the vaccine or pregnant after receiving the vaccine also is able to submit data to that. Again, in the clinical trials, remember, pregnancy wasn't studied, even though there was no reason to believe that it was unsafe in pregnancy. But this now is providing us a lot of data to support that as well. And so, not surprising, VSafe basically is reporting the same data the clinical trials showed. So the number one symptoms, pain at injection site. And just as in the clinical trials, we do see some more side effects after dose 2, but mostly fatigue for a day or two, headache for a day or two, but typically subsides in 3 days. So very similar data to what was seen in the clinical trials, just at much larger numbers. The pregnancy data is great as well. So they're comparing that data to what you would normally see in a normal pregnancy without vaccination, and then comparing, are they seeing anything different in pregnant women that have been vaccinated? And absolutely none. The comparables are exactly the same. They're not seeing anything out of the ordinary for people that have been pregnant or in any outcomes in babies afterwards. So very positive safety data for pregnancy. And then VAERS has been around the whole time I've been in public health. So it's our vaccine adverse event reporting system. And so this was in place long before COVID for MMR, any other vaccine. And anybody can report to VAERS any vaccine adverse event. It has some great things about it. Some strengths is that it would rapidly detect something. There are a lot of limitations, though, that it doesn't compare to unvaccinated individuals. And basically, there's anybody can report anything. If I had a heart attack, if I got in a car wreck, and so a lot of limits to it. But also, again, in some vaccines, in years past, it has picked up on maybe an early safety signal that they've gone in and looked at vaccine. And so VAERS reports so far through the middle of February, again, almost a million, 94% of the reports coming in have been non-serious, 6% are reporting serious. Now, again, remember this particular study, again, doesn't compare to unvaccinated individuals. We here at the health department submit to VAERS data, and we have done some submitting. I talked to our nursing staff yesterday, and most of them have been pain at injection site, swelling maybe at injection site, but that's the number one thing. We have done some VAERS reports on some, if anybody calls basically with anything, we're going in and completing that report. On their anaphylaxis, we did have one individual that did go into the ER, maybe feeling some tickling in their throat, and we went ahead and submitted that data to VAERS as well. But also, an individual that receives a vaccine, doesn't have to be a medical person, can also report data here. Anaphylaxis following vaccines. Normal anaphylaxis for a vaccine's about 1.3 to 1.6, depending on the vaccine, per million doses. The Moderna and Pfizer vaccine, a little bit higher, but not high, 2.5 in a million and 4.7 in a million. And again, the majority of people reporting anaphylaxis after a COVID-19 vaccine have had previous anaphylaxis from another injectable vaccine. So again, data showing very similar to the clinical trials and nothing alarming. And then one more study, and there's several more studies. I just picked a couple that was starting to release data, and we should have more data coming out in the next few weeks, and I'll keep everybody updated on that as it is released. So this is a study that looks through 9 healthcare organizations, and it does have comparable data. And again, this is something that's been in place for a lot of years as well for other vaccines. And so they look at some of those things that are reported. So if I've had a heart attack, if I've had appendicitis after receiving a vaccine, how that compares to the the normal population? And is there something that stands out? Like more people are having heart attacks, more people are having anaphylaxis, and reporting that. And you can see those as you go down. And again, nothing is showing anything statistically significant for increased risk after vaccinations at all. So great data and lots of data. I mean, lots of people are being vaccinated, lots of safety data coming in. So I just wanted to do some overall conclusions. And this was earlier, 75 million vaccines have been administered. We now know it's at the end of March, double that. Again, Be Safe is showing basically the same data that was reported in the clinical trials. Anaphylaxis continues to be very rare as reported, and no safety signals have been detected in VAERS. And then the pregnancy and infant outcomes have been observed during pregnancy. And again, nothing alarming in any of that safety data as well. So again, the CDC is again saying very confident in the safety of the COVID vaccine. And then again, I wanted to talk on the breakthrough, and James and Jerry talked about this a little bit. Again, what breakthrough is, and it's somebody that has a positive COVID test after 14 days of completing their series of vaccine. And again, all vaccine isn't 100%. We do ask the question about immunocompromising individuals and even maybe treatment that can also lead to some more immunocompromising. And we do let individuals know that if they're in that situation, that the vaccine may not work as well for them. This is just a CDC slide that's showing the efficacy against some of the variants, some of that post-licensure. Pfizer's starting to look at that. Some of the other data is pre-licensure. The more we move through this, though, we're going to continue to have data. Both Pfizer, Janssen, and Moderna are all looking at if they need to have a booster down the road, if it's not covered under variant or not. But right now, these are great numbers for variants coming and coverage of a vaccine. Again, we talked a little bit on this. Statewide, 97 confirmed cases. Half of those were asymptomatic. Again, 80% were reported as mild illness in the vaccinated individuals and breakthrough cases. As we were sitting here yesterday, we were talking about, who's vaccinated, who's not vaccinating, and about that wait and see group. Early on in the vaccination in December, we heard from a lot of people, I'm going to wait and see. And so this was a slide Kaiser Permanente had done. And it was interesting to me to look at mostly that wait and see group. So back in December, 40% of people in their poll were reporting they were going to wait and see how the vaccine did, if they were going to be vaccinated or not. And in their last poll in March, that actually had dropped to 17%. Some other interesting things on this slide is the people that are definitely not going to be vaccinated, we haven't moved that bar at all. Those people are still where they are. And I suspect they're going to stay there. I don't think we'll ever get that group to be vaccinated. And then a small group, only if required to be vaccinated. But again, the most movement on that is those people that we're going to wait and see. So I think this data that's coming out are having more people choosing to be vaccinated. And that is our ultimate goal. We need more people to be vaccinated. The more that are vaccinated, it's a tool, a great tool. I think James said that, a great tool in our belt to get back to some normal life. And so I found this from a doctor, top 10 reasons to get vaccinated. So I wanted to share this. I kind of wanted to end on this a little bit. Number 10 is free. That cost should never be a barrier to anybody being vaccinated. Again, I think the data supports it's highly effective. Even though we're seeing breakthrough disease, I think that was expected. It is expected. No vaccine's 100% effective. We just need more people to have vaccine in their arms. And again, I just presented number 8. It's safe, the data. Number 7, again, we're seeing data that supports even if you get COVID after a vaccine, I think Commissioner Young, you asked that question. It does seem to support that you're getting less sick as well. Number 6, it protects those around you. Number 5, it protects yourself. Number 4, one of my favorites, keeps your cash flow strong. If you're not sick and home and not having to go to work or doctor's appointments, another positive. Number 3, COVID vaccine does not give you COVID. There's no way, no how. Number 2, the right thing to do. And number 1, again, it's a key tool to get back to normal, to get back to, to some of these other things. And even though we're still having to do the mask and social distancing, there is recommendations coming out now for individuals that are unvaccinated, being able to be around other individuals that are vaccinated. But no, I think for us, it's important now to get more people to be vaccinated. And the state of Idaho is starting some ad campaigns for this, and they're really quick 30-second ads. And I didn't know if we could click on that, Jerry, and just watch this one real quick.
Playing.
I don't know if it's sharing.
What did you?
It's not playing on here.
I don't know what else to do.
You'll have to stop the share, I think, and go to that one.
So that's just one of the ads. I think they have 5 or 6 more that you should start seeing come up on that. And I'll uh-oh.
That Explorer.
Where?
Edge on the left.
Where?
Microsoft Edge.
Stop it.
Hit that.
Technical difficulties.
Autoplay.
But I'll continue to look at both the efficacy and the safety data as it's released, but 100% confident in the vaccine, that it works, that it's safe, and we'll continue with our vaccine rollout, looking at maybe groups that we're not getting to, making sure that people have access to it. The biggest thing, with the April 5th announcement that vaccines open to everybody 16 and up, just making sure we get that word out there, letting people know that they're eligible for vaccine. And I will now stand for questions.
Yeah, go ahead.
I just want to say one thing too, as Amy's talking about making sure it's accessible to everyone. There's a lot of discussion at the state level about equity of the distribution of the vaccine. And, we are trying to do outreach in all of our communities. We've done one Spanish clinic. The participation in that clinic was not as high as we had hoped. But I would just look to each of you that if you know of populations in your community that may be overlooked or having a hard time accessing the vaccine, whether it's for transportation or, hours of clinics that are offered, we would ask you to help us in sharing that information so we can take some measures to address that. So.
And then as those come in, we're looking at how we can accommodate those populations. So congregate settings, we're actually going to them to provide vaccination, or I know James has partnered up with a lot of other partners to get to some of those facilities that have more difficult to access vaccine.
And then just to end on a positive note, I'll just say that supply is increasing as well. So the governor did announce April 5th, no later than April 5th. But again, re-emphasizing what Jerry said earlier, that we're moving as of today to anyone 16 and older who would like to get a vaccine. Again, 16 is the minimum age you have to be for that is FDA approved for these vaccines. 16 and 17-year-olds must need to get the Pfizer vaccine, so they'll need to look for Pfizer clinics. And then anyone 18 and older can get any of the 3 vaccines. But supply is increasing. When we started the senior population in early February, we were receiving approximately about 2,000 doses a week into our health district. We're now receiving 5,000, and we've seen an increase in bump from the last few weeks of even more than that, of 6,500, and this next week we'll get closer to 7,500. That will continue to increase as the manufacturers increase their ability to produce the vaccine and ship it to us quickly. So again, the supply is there for individuals to get the vaccine. The providers are doing a great job of getting the vaccine, not only Eastern Iowa Public Health, but who's seen the vast majority of the vaccine, but other providers as well, and we'll continue to get that out. So accessibility is not a problem for individuals.
Just I'll end on maybe one last note that anyone that wants a vaccine at this point can just call us at Eastern Iowa Public Health, and we'll schedule you into the next clinic that we're holding in your respective county. People can still go on to the pre-registration tool at coronavirus.idaho.gov.
Yeah.
It's right there at the top of the page to access the pre-registration tool, but anyone can call Eastern Iowa Public Health's number at 208-533-3223 and get scheduled for an appointment right away. So we'll open it up to any questions that you may have.
Well, I appreciate all you're doing. Yes, Commissioner Madsen.
Hi, Commissioner Madsen. I don't know who maybe to direct this question or if it's even, but throughout COVID, I have seen a larger number of like mental health concerns in regards to isolation, job insecurities, job loss, incomes, loss of homes and rentals. I know in our community, I've seen a spike in mental health issues, even at school level, kiddos. So in regards to activities and whatnot, are we focusing on any of that and getting more or help to these communities? I know elderly people are more isolated at home. They're having more health concerns just because of the whole depression and or suicide thoughts. Just putting that out there.
Commissioner Madsen, I just replied that is something that we certainly are concerned about and have talked about that from day one. Certainly now, I would hope that we're not seeing as much of that as things have opened up and people should not be isolated like they were back in March and April of last year. The state has received funding and has a COVID Help Now hotline that anyone can call. And I will make sure to forward that information on to you. And I know you have only been part of our board for a short while, but we've had psychologists on our board giving presentations and talking about those issues as well over the last year. But it's certainly something that we as public health are concerned about and trying to connect people with resources in their communities as best that we can.
Thank you.
Are there other questions from board members? Dr. Nelson, I wondered if you would, with all of your training and your experience, what is your view and how do you feel the importance of everyone being vaccinated is?
I missed part of your question, Commissioner Reed.
So with your experience and your training, I guess I would just love to hear your view of the importance of the vaccine.
Oh, we can't overemphasize the stay in our communities, and the vulnerable populations are always going to be at risk. And if we can protect those around us by getting a baseline immunity, we're going to see a lot lower spread.
So that goes to the herd immunity, which is best obtained through the vaccine, is my understanding.
Right. The natural immunity hasn't been as protective because these viruses mutate. So in the future, we're predicting that we'll receive our annual COVID booster shots the same as we get a shot because viruses mutate, and we're not sure we're always going to be protected by just a one-time vaccine.
Thank you. And I just
also one thing that slows mutation in a virus is decreasing the transmission in a population. So we're less likely to see mutations if we have a higher percentage of the population that is immunized.
All right, thank you. And I just feel that this is the way to help us all with the mental health challenges that have been created in our communities, with the physical challenges, with the work challenges, just with all of these challenges, the safest and quickest way to overcome these is through a vaccination. And we're certainly seeing, I was surprised this morning and really enlightened, Amy, through your report, just to see how safe it has been and how well it is working. So that be safe information, all those people believe that the clinical trials went through quickly, and that this vaccine did somewhat miraculously come to us in a alarming, and really fortunate speed. But now with all of the vaccinations that have been given, and then still seeing those mirror the trials for safety is really gratifying to see that. We're really fortunate to have this as a tool right now. Are there other comments or questions?
Mr. Chairman, I would just say the very last comments I'd like to end on, and the vaccination is incredibly important, and we would certainly encourage everyone to consider getting that to protect themselves as well as those around them, like Dr. Nelson said. But because we're not at the level of herd immunity that's needed for that community protection, it's still important to do those other things for the time being. And first and foremost, stay home when you're sick, maintain physical distance from others. We are seeing new CDC guidance that, vaccinated people have more ability to interact with others that are vaccinated because of that protection that's offered. But staying home when you're sick, washing your hands, and wearing a face covering when you can't physically distance from others. So just wanted to end on that note. Those mitigation measures are still critically important for the time being.
Okay, thank you. All right, seeing no other questions or comments, we'll go ahead and move to the next item on the order. We're taking them on our agenda, which is our legislative update. And we'll go to Mr. Lake for this. He has been attending our weekly executive committee meetings throughout the state, where they have been following legislative issues that pertain to public health. So go ahead, Bill.
Thank you, Commissioner Reed. What Jerry's got up there right now is the Senate Bill 1060, that the essence of this particular bill is that it's going to all the authority to the public health districts to be independent from the other state agencies. Yes.
Sorry, this is not that one. This is 1060 that requires any public health order.
Okay, I'm sorry, I got it mixed up with the other one.
Yeah, sorry,
Okay.
that one's next.
Okay, so this particular one is the bill that that does away with the CAT funding, or the CAT system, and the counties will now become responsible for paying for the public health districts, that portion of about $10 million a year that had otherwise been paid for through state funding, on top of the already existing county funding that has always been there for us. So I'm just looking at what's up on the screen now.
That's House Bill 316. And where are we on that? My understanding is it's only gone through one body. Is that correct?
Well,
Yes,
the governor,
yeah.
the governor just signed off on it, and make sure we're talking about on the fiscal note here. So did this governor sign off? He signed off on this House Bill 316.
No.
He signed off on
1060. Senate Bill 1060.
Okay.
May I step in for just a moment and recap a couple things?
Yeah.
I want to go back to House Bill 1060 and just to quickly summarize that this is the bill that the governor has signed, and this is the one that that requires that if a Board of Health issues a order that is county-wide, that the county commissioners within that county have to affirm that decision within 7 days. Again, the governor has signed, but I also wanted to share with you this letter of transmittal that was shared regarding this specific bill, and I'm going to read it. It says, Mr. Secretary, I have the honor to advise you that I've signed on March 19th, and I'm transmitting to you the Senate Bill 1060. I signed this legislation with reluctance. I agree that we can all use our experience from the COVID-19 pandemic as an opportunity to learn how we can strengthen our state's public health system and improve a statute that is 50 years old. However, I fear this legislation creates potential barriers for local public health and could impede their ability to quickly and appropriately act in the case of a public health emergency. Once this pandemic has ended, I respectfully request the legislature, public health district representatives, state public health officials, and representatives from the medical community to revisit the issue and examine any unintended consequences this legislation may create. But with that being said, there was an emergency clause, so this bill is in full force and effect at this point in time as of March 19th.
So, Mr. Chairman, this is Commissioner Mendenhall.
Yes, go ahead.
Jerry and Bill, with this Senate Bill 1060, does that mean that if heaven forbid, we go through the roof again and we have a desire to issue health orders, I still don't like it being referred to as mask mandates, but health orders, because it's effective immediately, county commissions in each county where a health order is issued would have to accept or approve it before it could go into place. Is that correct?
Yes, that is correct, Commissioner Mendenhall.
Thank you.
So I want to go back to House Bill 316 that Bill was talking about, and this is one that the public health districts have been working collaboratively on with the Idaho Association of Counties. And Bill, did you want to go back and talk more about the intent of this bill?
Yeah, on this particular one, like I said, the CAT fund that had been set up that the counties paid into, that they'll no longer have to pay into, those funds are now available for the counties to be able to pay for the health districts' share that the state used to fund. It's almost a wash, except in our district, we've been probably better than most districts in how we've used the CAT fund. And so we're not going to save as much as the other health district counties. So it's not going to be a break even for us. It's actually going to end up costing a little bit more. I don't remember the exact numbers, but that was in lieu of them taking away the shared funding. There's a name for it I can't think of right now. that
Revenue sharing.
the revenue sharing. So the county said we'd rather not lose revenue sharing, take it out of the CAT fund, and go this route.
So this particular bill has passed the House. It did have one hearing in the Senate Health and Welfare Committee just the day before the legislature shut down. It was scheduled for a continuation of that hearing. And at this point, that has yet to be rescheduled pending the legislature coming back into session on April 6th. I know there were some concerns shared both on the House side, but also on the Senate side about the impact it could have to the hospitals, simply because they are required to pay to care for patients that present. And if there's no CAT fund, and really the basis is if people are eligible for Medicaid, then they would not, but chose not to enroll, they would not be eligible for county indigent funds or the catastrophic healthcare fund to cover those costs. So I know there have been some conversations ongoing between IAC and hospital representatives to try to address maybe those concerns. But we anticipate this coming back for the remainder of the conversation in the Senate Health and Welfare. I would anticipate early next week, midweek next week. The full bill is here for review, and it does do a little more cleanup of the statutes involving public health districts, giving the authority of setting salaries to the district boards of health rather than being oversaw by the governor or DHR or any of the state agencies. Those are the main concepts of this bill. And this, we don't know how this is going to play out. I don't really have a great sense of if it's going to pass the Senate or not. And it is creating a little bit of challenge for us as we are having to develop our fiscal year 22 budget of what that might look like. If this bill does pass, the portion that would require the counties to make up the nearly $10 million just statewide and funding to the public health districts, that would not go into effect until January 1st of 2022 to allow the counties the first quarter of the revenue collection, then to be able to start funding that back to the health districts. And so if it does pass, we will get state appropriations for the first 6 months of the year, the new fiscal year, and then the county funding will kick in for the second half of the fiscal year. So I want to just see if there are specific questions. I know the counties have been had the opportunity to have multiple conversations with Seth Grigg about this bill and potentially the impact on the counties. So I'm not necessarily privy to all of those, but I don't know if there's any questions of the board members that we might be able to answer on this one specifically.
Are there questions? Board members, I'm sure you've looked at it in your own counties. I know in Bonneville County, it will be a negative effect to the effect of several hundred thousand that Bonneville County would owe to help support the health district in comparison to what we've been paying in our indigent relief. And that is simply because, and we've seen it throughout Eastern Idaho, it's because counties and our hospitals have been very frugal, if you will, or cautious with those indigent funds. And we've been very responsible with them. And so we have been able to hold those amounts lower through all of the work we've done to ensure that only the correct procedures are being done at the hospitals. But because of that, compared to the rest of the state, this will cost the counties more in our district as a general rule. However, I think there's some good side. I think having a little more local control over the health district in regards to salaries and programming, you know, local eyes on the topic seem to always make for a little more efficiency with the dollars. So I'm supportive of the bill. Are there any other comments or concerns or questions?
Commissioner Reed, I think, is this the bill where the charges for the pre-committal on the mental health that's going to be required to be paid for by the counties? That there was kind of an issue that I think Mike Kane brought up.
That was being discussed, but I'm not sure it was ever added. Was it, Jerry? Do you know?
I have not seen any changes to the bill.
I don't think it was ever added, but I know that's part of the discussion on the Senate side.
Right. I thought it was added, and that was going to be, that it basically said that the counties would not have to pay for that. And then the question was, well, then who is going to pay for it? And that was a no-go for the counties if they took that out. But could you maybe scroll down and just a little bit into the bill? Yeah, I guess I don't remember.
I know that
exactly
was, excuse me, Bill. I know that was part of the discussion, and yeah, the legislature was forced to adjourn, you know, right in the middle of this, and so I'm not entirely certain as well, but I don't think it was ever added.
Okay.
Are there other questions or comments? I did find it very interesting, the governor's letter when he signed 1060. He has been very supportive of public health and wants to ensure that Idaho has strong public health agencies going forward. And I just think he's been very pragmatic and very cautious and deliberate in all of his actions in regards to public health. So certainly there's going to be more discussion, it sounds like, going forward. But as for now, as Jerry said, we are under the changes that were made in Senate Bill 1060. Okay, with no more discussion, we'll go ahead and move on then to the final item on our agenda, which is a fiscal year 2022 budget planning.
Thank you, Mr. Chairman. And I did mention that we are in the throes of developing our budget for next fiscal year. At this point in time, with not knowing the outcome of the bill that we just talked about, we are proceeding to develop our budget as we always have, on the assumption that we'll receive the state general fund dollars. I can tell you that for our health district, the amount of state dollars is very comparable to what we received from the counties. For fiscal year 21, it was $1,215,500, and the county appropriation was $1,120,703. So just about $90,000 difference between the two. So we are moving forward with developing our budget, assuming that we'll get the state general funds. We did get guidance just 2 weeks ago from Division of Human Resources and the Division of Financial Management. And every year they do send out guidance on change in employee compensation, or CEC, that we use when we do our budget planning. The direction at this point is that the legislature is implementing a 2% increase in compensation for employees for fiscal year 22, as well as adding in a 2% that was originally planned for 2021 that was never implemented because of holdbacks and things that were just put on hold because of the pandemic. And so ultimately it will be a 4% CEC that the legislature is directing. In the past, we tried to follow very closely the guidance that comes out from DHR and DFM, but our board has also done other things for change in employee compensation. Historically, our health district has been at the bottom or very near the bottom of all 7 health districts in our compa ratio for employee salaries in our health district. And so in the past, we've done a little bit more to try to make that a little more equitable between the other health districts. And so I don't have really a good sense to provide you right now, but that is the primary focus of our April 29th meeting will be the budget presentation. By then we should know whether or not the House Bill 316 is going to pass. And if it in fact does pass, we will still need to implement a budget for July 1. And then I would anticipate that at some point early in fiscal year 22, we would rework that budget to include the changes that are being made with the state funding and the county funding. It definitely will take some much more dialogue with the commissioners and the budget committee, which is the chairman of each of the commissioners, as to how that distribution of that new county appropriation will work in our health district. But right now we're just kind of at a wait and see point. So we're proceeding and developing our budget. We'll present that at our next board meeting. One last thing on compensation I would say is for the past several years, there has been an increase in the pay line that is used for the salary structure at the state, which we fall under. And so the minimum pay for the different pay grades has been increased by 2% for many years. I want to say we're on 5 now. The challenge is when the annual salary increases for employees don't keep up with that, we find ourselves with having significant salary compression because a new employee will come in and potentially could be making more money than someone that's been here for several years. And so I just want to say that we will be looking at salary compression and potentially include some measures to address some salary compression potentially in our budget for fiscal year 22. So with that, I would just ask if there are any questions specifically about as we prepare our fiscal year 22 budget.
Any questions? I might say that it's been my observation that although unfortunately our health district has been among the lower for compensation amongst the health districts in the state, our staff at Eastern Idaho Public Health has been among the leaders in response and effort that has been put forth through this challenging past year. So I hope we'll be able to take a look at that and make corrections where needed, because they certainly are needed. So
thank you.
Any other questions? Okay, anything else, Jerry?
I did not add it to the agenda, but just one quick announcement that on June 17th, the Idaho Association of District Boards of Health, or what we refer to as IAB, will have their annual meeting. It's not the full-fledged conference like we've had in past years. It is being hosted by South Central Public Health District out of Twin Falls. There will be a virtual option, but also if you choose to drive to Twin Falls to be part of it in person, you're welcome to do that. It will only be the business meeting that's held again this year. And then there are hopes that in 2022 that we can get back to the full-fledged conference. So mark that on your calendars. I don't have times yet, but June 17th.
Okay, thank you. And meeting schedule going forward, what do you foresee, Jerry? We will meet on April 29th for our budget meeting. I guess you're not sure beyond that. It depends how things continue to roll out as far as the pandemic.
Yes, that's right, Mr. Chairman. And we've only scheduled at this point meetings through June 3rd. And I'll just pull that up on the calendar, on the screen for you. So we'll need to make a determination at our June 3rd meeting. And I think at that point, we'll have a better sense if we can get back to our regular meeting schedule that was, every 2 to 3 months. But we will meet on April 29th for our budget presentation. Starting after that, in May, I will be making arrangements to meet with all of the county commissions to discuss our budget. And then June 3rd is our next meeting. We do have to schedule at some point the public hearing that has to happen in June. So that's typically just a very brief meeting if we don't do it in conjunction with a regular board meeting. And then I think we just need to see where we are in a couple months from now of what the rest of this calendar year looks like for our meeting schedule.
Okay, so mark your calendars, board members, and typically, and maybe we'll try to do that, even if it's a separate breakout virtual, we take care of that budget during the IAB meeting, so possibly we could put that in conjunction with the June 17th meeting. Will that work for you, Jerry?
I'm sure it will.
Okay, so if you would hold that day open as the state meeting, as well as a short budget meeting for Eastern Idaho Public Health to make a motion to approve the budget. And so that'd be June 17th. So we're looking at April 29th, and then June 3rd, and then June 17th. And it would be my hope that after that, we can go back to our typical meeting schedule, which will lighten the workload a little bit on our staff and also help with the budget. Is there any other questions or concerns, comments?
Chairman, Jerry,
yes.
Those will be at 7 a.m. too, the budget presentation.
That is what is on the schedule right now, Mr. Shenton.
Okay, thank you. Just clarifying.
Yeah, thank you. And we'll have to get you a time for the June 17th as it gets closer and we find out how many board members will be going to Twin and how many will be doing it virtually. So, all right, is there anything else?
Nothing from us.
Director Rakow, thank you for all of your efforts, for everything that you do, and as well as all of your staff, who has been just extraordinary this past year. As a community, we thank you for the service that you're giving, and now for this vaccine rollout. I know it's been a monumental task that has proceeded remarkably. And so we appreciate everything that you are doing. Seeing no other comments, I'll go ahead and close this meeting then. Thank you all.